Hi all, this is Dr. Parekh. Welcome. Today we'll be talking about depression treatment. Last time we talked about symptoms of depression. Today we have Dr. Rajendren again to talk about the treatment part. Dr. Rajendren, welcome back and thank you for being here.
I'm happy to be back. Thank you for having me here.
Thank you, sure. So how do you treat somebody who is depressed?
So there's various modalities of treatment. One of them is lifestyle modifications, another is therapy, different kinds of therapy, and the other is medications.
Okay. Can you tell us a little bit more about medications?
So there's various kinds of medications, various classes of medications, especially antidepressants for anxiety as well. And a lot of people, because of the stigma associated with mental health treatment, they're really afraid to go seek help and they keep putting it off. But when it's left untreated, especially if it's evaluated by a professional who feels like they need treatment, it can actually get worse. The depression and anxiety can get worse, and it can have a worse effect on your brain cells than actually taking medications. And so medications are always about risks versus benefits.
Correct.
Like, for example, if you have like a knee pain and you've gone to the orthopedic surgeon and they told you that you need surgery as soon as possible, like a knee replacement. But then just the thought of having a knee replacement, taking time off work, staying in bed, it all sounds really huge. So people don't want to go do it and they keep pushing it off. So what happens? The knee pain gets worse and they can get to a stage where they cannot walk. They might need a wheelchair. This is exactly the same thing that can happen. Because they're associated with neurotransmitters, it's actually a chemical imbalance. Depression is a chemical imbalance. There is a deficiency, an imbalance between three neurotransmitters: serotonin, norepinephrine, and dopamine.
There are several misconceptions around medications for depression. For example, there are a lot of side effects like weight gain. What do you think about that?
So anything that you put in your body, for example, including food, has side effects.
Correct.
Cookies over time can cause high blood sugar. It's just every little thing, anything you put in your body. So it's always risks versus benefits. So if you need the medication, you take it. That's pretty much how it is. And as far as side effects, there's many classes of medications. There's we always try to go with the ones that have minimal side effects because we want the best for our patients. And most of them actually do not really have weight gain. A lot of my patients have not really reported weight gain on antidepressants. They in fact, if they do have side effects, and the side effects are really bad, they don't go away, we can always stop the medication and we can switch to something else that works better.
Okay, that's great to know. The other common misconception is that if I take this medication, it's going to make me like a zombie or make me feel numb. Is that true?
So sometimes I've noticed that patients who do feel really sedated, especially on antidepressants, not other classes but just antidepressant medication, they tend to be over-medicated. And there are some people who might also, especially in certain countries, developing countries where mental health is not very well thought of, there are patients who put on like antipsychotics when they're just depressed, and that can make somebody be sedated. So most of the antidepressants by themselves do not make people sedated, and I think patients only need to be on what they really need, not extra medications. A lot of people have actually reported that in fact taking medication, when they're depressed, they actually feel very tired and fatigued because they're not sleeping very well and they have no energy. And when they do start taking the medications, they have a higher motivation to do things, more interest in activities, and they feel higher in energy as well.
That's good to know. Sometimes people think that if I take this medication or take these depression medications, it'll change my personality. What do you think about that?
So there is this misconception that people do think that medications make them be or become who they are not. And so they feel like they're leading a false life. But that's actually not at all true. In fact, normally people are like healthy, they're full of life, they're doing things, they're motivated, they have good focus. And when you're depressed, you actually lose some of these things. And you're really tired, you can't really function very well, and you're irritable a lot of the times, you snap really quickly. So that's not really you, it's the depression that's causing those things. And so when you're actually on the right medication, it corrects that imbalance that we were talking about earlier with the neurotransmitters. And so actually what I think is that when you really need them, medications actually help you feel more you.
The other common misconception is if I take it, I'll have to take it for life. Is that true?
That's not necessarily true. So it depends on the type of depression, the severity of the depression when we first see the patient doing an evaluation. And even then, we can't really tell each person when they can get off medications. But I do have a lot of people who are going through something stressful for a time period, and when things get better, they are able to get off the medication and they're able to stay off it. And then there's some people who we try to get them off it, and then they actually feel like they preferred themselves being on it, and they actually felt like they were living life more fully when on the medication, and so they want to be on it, and so they stay on it. So even if it gets to that, it's not the worst thing, because just having to be on the medication for their whole life it's not wrong. It's just like if you, for example, needed insulin shots for diabetes and you had to you take it your whole life, you're going to be okay with that. It's just an adjustment in the beginning, and that's exactly how it is, because there are, like, Prozac is the first antidepressant, and that came out in 1985, and there's patients who've been on it for like more than 30 years and they're doing fine.
The second modality of treatment is therapy, psychotherapy. Can you throw some light on different kinds of therapy?
So there's various types of therapy, and it just depends on when we actually see a patient for evaluation. It will do the kind of therapy that they need, or will recommend for that kind of therapy. And so there's, just going over it briefly, there's psychodynamic therapy, there's CBT, which is cognitive behavioral therapy, there's DBT, which is dialectical behavioral therapy, and there's ACT, which is acceptance and commitment therapy, which is not very well known. There's also supportive therapy.
Dr. Rajendren, when it comes to therapy, there's a lot of hesitation. People hesitate to go see a counselor or a therapist. Why do you think is that?
That's mainly because of the amount of stigma surrounding the idea of therapy.
Yeah.
So people think, oh, if I go to therapy, that means I must be, if I'm mentally ill, something is wrong with me, I must be crazy.
Yeah.
So obviously they don't want to go see a therapist. But what I think is that it takes a lot of courage to actually take that step and see a therapist, to actually want to be open to change and to want to learn and grow. And not everybody can have that kind of courage. I actually think you have to be really high functioning to be able to go to therapy. You have to be intelligent to be able to be open to change like that. And a lot of times people go to a session or two and they feel like, oh, there's no change, therapy doesn't work. That's commonly what you see out there as well. But I think that it takes time, like anything else, for you to actually learn things about yourself and to be able to grow. It's not going to be instant. And I would compare it to actually watching your hair grow. It's really subtle, but before you know it, and at some point it's like, oh, it's actually grown. That's exactly how I link that.
So that's a nice analogy. Dr. Rajendren, the third modality is lifestyle modification or lifestyle changes. What are some of the lifestyle changes that one can make in order to feel better when they're depressed?
So there's a few lifestyle modifications that can be made. One is exercising regularly, and then eating a nutritious diet, getting a good night's sleep every night. Yoga, meditation can help, and having a good social network, a good social support, a good circle of people that you can connect with. I think those are all the important.
Thank you, Dr. Rajendren. These were some great tips. Hope you all found this useful. In one of my upcoming videos, I'll be talking about lifestyle modification and depression. I'll be putting a separate video on that. Once again, thank you, Dr. Rajendren.
Thank you for having me here. So I'd like to end by saying that if you're feeling anxious or depressed, you have to understand that there's no shame. You don't have to feel that way. You don't have to feel embarrassed to seek help. And you just got to treat it like you would treat any other medical illness that you have, and get help for it as soon as you can.
That's right.
Thank you.
Stay tuned, guys.